Hello everyone, welcome back to our Materia medica classes. In previous video we had discussed regarding agaricus through sphere of action point of view, and today we are going to discuss regarding the plant which is shown in the screen. I think most of the people might be knowing what drug we are going to discuss because it was already mentioned in the thumbnail. It is none other than Colchicum autumnale. So there is a secret. I am going to introduce my strict uncle to you. So let's see how he is going to react. So common name of Colchicum is meadow saffron and family name Liliaceae, and it was proved by Dr. Staff. In this video, first we are going to discuss regarding the basic understanding of Colchicum. This will surely help us in our OPD practice. And second, we are going to see regarding the Colchicum image. This will help you to remember the Colchicum very easily. Then Colchicum mnemonics, which is more and more important for examination purpose. So let's see in detail all the things. Before going in deep with the understanding of a materia medica drug, we should know where these particular drug has its more specific action, that is none other than sphere of action of the remedy. So the more primary action is in the gastrointestinal tract. Then we can see the action of Colchicum over the kidneys. And also Colchicum have minor impact over the heart also. Colchicum has major impact over the joints. So in the process of understanding the action of Colchicum over the joint, we should know regarding the structures around the joint where Colchicum has its more prominent action. Here, this one is articular cartilage. Here we can see the ligaments and tendon. And here comes the muscles. And this is our synovial fluid or synovial membrane. This one is bursa. So here, the third most predominant action of Colchicum is over the joints, and where it involves all the tissues like bursa, synovial membrane, synovial cavity, then muscles, then articular cartilage, then ligaments and tendon, all the things around the joints. So this is my uncle. Still now I had not named him. If you are interested, you can give him some name. So he was a robust person of vigorous constitution. You can see his muscles and body build. Actually, I forgot to inform you people that this first picture is depicting my uncle during his younger age group, and now my uncle had become very old. So these are all the two important constitutions of Colchicum. One is robust person of vigorous constitution and another one is old diseases of old people. Try to remember both the faces of my uncle. This is more important. And as he became very aged, he was subjected to all the rheumatic and gouty issues. So that became his diathesis. Diathesis is nothing but hereditary or constitutional predisposition to a disease. So this is all regarding the constitution and diathesis of Colchicum. So better understanding of a drug always deals with sphere of action and understanding the modalities in general. So let's see what are all the things my uncle don't like or he will get aggravated because of. So first thing, my uncle does not want to move because he is very much aged and he don't want to be touched by anyone, mainly where he used to get all the rheumatic and gouty pains, and his pains and everything mainly gets aggravated during the night time. Touch is mainly stabbing of great toe. He is very much afraid of because it will create such an unbearable pain which has been mentioned in Chamomilla. Uncle is very chilly. He cannot tolerate cold, damp weather. In the before picture itself, you had seen that he was wearing sweater. And he cannot also tolerate changing of weather. And all his complaints gets aggravated during the autumn season. So in the name itself you can see it is Colchicum autumnale. So whenever we are hearing regarding the autumn season or spring season aggravation in Materia medica, we used to think okay it's happening during that time. But the most important thing which we have to know is that autumn in India starts from September to October. So if a patient having the similar complaints of colchicum coming at September to October, we have to suddenly remember regarding this autumn season aggravation. That will help us to get into the drug easily. And then mainly my uncle have aggravation from checked sweat or suppression of sweat also, but I don't know how he will express me this symptom. That was one of the challenge. And my uncle also can't tolerate the smell of food because my auntie is cooking in that way. What to do, we can say it openly also. And my uncle cannot tolerate night watching also because he don't want to do any hard work. Already he is in elderly age group, and why he have to work that much hard, है ना? So apart from the smell of food, he cannot tolerate other external impressions such as light. Then he cannot tolerate the noise. He easily gets irritated because of all these things, and he cannot tolerate any strong odors. Let us assume the odor from flour or odor from any other thing, like even smell of cooking food he cannot tolerate. And already I had told that he cannot bear this touch, mainly contact. He cannot bear the contact also, and he cannot tolerate the bad manners of people. He cannot tolerate the bad manners. My uncle is very strict, as I had already told, so he cannot tolerate if anyone is doing any idiotic things in front of him. Okay, so these are all the things you should know. So in case of aggravation, motion, he cannot move, he don't want anyone to touch him, mainly his toe where he is having the rheumatic complaint, and night time he used to get all his complaints aggravated, and he cannot tolerate the cold damp weather, and he have problem with change of weather also. And mainly colchicum autumnale we have to think during the autumn season, that is none other than the fall, which is commonly seen in India from September to October. And our uncle is also having problem with checked sweat, and he also have problem with smell of food. Other than the smell of food, he have problem with light, noise, then strong odors and bad manners of other people, and he cannot tolerate night watching also. Then like what is the need of studying hard at night even after getting old? That is the point, right? So now let's see what are all the things which helps uncle to get rid of all his complaints. That is none other than warmth and rest. He just want to lie down and take rest, and he want to shut away from all these things without any interruption. So these are all regarding the modalities of colchicum. Just see how much he is very strict. So now regarding the action of colchicum on the gastrointestinal tract, now I would like to share a case which was presented by Dr. Nash. So there was a old lady. She was completely collapsed and debilitated, and she was complaining of history of diarrhea, and that too the diarrhea is very frequent, around 65 episodes in 24 hours. Even she cannot lift her head from pillow, that much of debility. And she was having severe nausea from the odor of cooking food. So this symptom was particularly noticed by Dr. Nash when the old lady cannot even tolerate a slight opening of kitchen door, and she was irritated and she was shouting to close the kitchen door. And that time she was prescribed with colchicum 200, and there was marked improvement in the condition of the patient. And here this aggravation from odor of cooking food can be compared with another three remedies. They were arsenicum album, then sepia, and the last remedy is cochlus. These three remedies we have to think and we have to differentiate whenever required. And all these things forms the complete picture of colchicum. And here Dr. Nash had mentioned one symptom which is contradicting to each other, that is, he found burning and icy coldness of stomach. These two things are exactly opposite in nature. Burning and icy coldness. Here comes our uncle who is having both the contradictory symptoms of burning and icy coldness. And here comes third, the most important symptom, that is tympanitic abdomen. So here Dr. Nash and Dr. Kent had mentioned regarding the farmer's cow, where the cow was suffering from the tympanitic abdomen and it was seemed like it was about to burst, like that much big abdomen was there, and the cow was prescribed with colchicum medication and the symptoms relieved with marked improvement. So this is one of the main symptom of colchicum whenever we are finding tympanitic abdomen along with all the other symptoms. Then Dr. Farrington had also mentioned regarding the autumnal dysentery. So here he had mentioned if a patient is presenting with autumnal dysentery with tympanitis, then we can think about colchicum. And here he had compared this remedy with mercurius and cantharis. In the stool past, we can see the scrapings of intestine like this. We can see white shreddy scrapings of intestine and jelly stools. Here this symptom can be compared with another two remedies. Those were cantharis and carbolic acid, where we can see the similar scrapings of intestine in stools. So these were the four important things you have to remember in case of gastroenterology. So here the first thing you can remember easily with the help of this case, that the old lady who was completely collapsed and debilitated and she was having the frequent diarrhea of 65 episodes per 24 hours and she cannot lift even her head from the pillow and she was having severe nausea which is getting clearly aggravated by the odor of cooking food. Here we can compare arsenicum, sepia and cochlus, and here the patient was prescribed with colchicum 200 and there was marked improvement. And then comes the second point of discussion, that we can see the contradictory symptoms as mentioned by Nash, burning and icy coldness. And third point regarding the farmer's cow, you can remember it easily, that is tympanitic abdomen. And at last, the fourth point, it was mentioned by Dr. Farrington. If there is autumnal dysentery along with tympanitis, then we have to think about this remedy colchicum, and here we can compare it with mercurius and cantharis. So in case of autumnal dysentery, our stools will be having white shreddy scrapings of intestine with the jelly stools. So this exact symptom of scrapping of intestine we can see in case of cantharis and carbolic acid. So now regarding the second primary action of colchicum, that is none other than tissues and joints. So let's see how uncle is suffering in case of rheumatic complaints. So even in the old school practice, this colchicum was mainly used in gout, which is none other than the metabolic disorder in the problem with the purine metabolism. So if there is gout, we all know that there will be involvement of joints, mainly great toe, and it can be followed by knee joint. So uncle is suffering from joint pain which is shifting from one joint to another. So here the most interesting thing, in case of warm weather, the pain would be light and superficial, and in case of cold weather, pain would be more deeper, affecting the bones and tissues. So all these complaints were associated with marked debility. As I had already told, uncle is having that much of unbearable pain, so he don't want to move or he don't want to get touched by anyone. Mainly he don't want anyone to stop on his grade 2. He was very much afraid of it because of the unbearable pain. Here we can compare the unbearable pain with chamomilla. So because of all these issues, what will happen to our uncle? Uncle is already very irritable and he is very much oversensitive to all the external impressions we know. So he became very rude and very strict. So let's see. First, uncle is suffering from gout and rheumatic diathesis, which we had already discussed. So most probably gout we can see in the great toe and knee joint, and here the joint will be having all the inflammatory signs like swelling and redness, and it is followed by the joint pain, which is having its nature of shifting from one joint to another. Here in Allen's keynote it was mentioned that the pain moves from left to right side, which can be compared with lachesis. And in case of warm weather, the patient will be having light and superficial pains, and if the patient and if there is cold weather, then the pain will move deeper and causes affections in case of bones and tissues, and all these complaints were associated with debility. And already I had told, because of the fear of pain, our uncle doesn't want to move, doesn't want to get touched by anyone, and that may lead to that severe pain. So he is completely now in the irritable and oversensitive state to all the external impressions like light, noise. He don't want anything to disturb him at all. So this is regarding the tissues and joints. Here the action of kidneys of colchicum is mainly seen through the urine and dropsy. Here in case of colchicum we can see generalized dropsy in abdomen, lung and heart. So in case of heart it will present as pericarditis, and in case of lung it may present as pleuritis, and in case of abdomen it may present as peritonitis, and all these things are associated with pale urine. So, in case of colchicum, we can see the most colorful urine. Let me tell you how it will look like. So, in case of gout also, we can see the change in color of urine. In my OPD practice, I think one patient came with severe gouty pain, and the symptoms was corresponding to benzoic acid, and the patient had shown me a brown color urine. Okay, and after prescription of benzoic acid, his pain had also got reduced, and after 3 to 4 days, his urine became very clear. That time I had noticed the exact color change in urine also. So let's see what is going on in colchicum. Our uncle is having dark, scanty or suppressed urine. Either it will be coming in drops with white sediment. Sometimes patient who used to get suffer from nephrolithiasis, they used to say these type of symptom, because some stones used to get dissolved and come in the form of white sediment, that we have to pre-inform the patient. And there may be bloody brown black ink urine. So this I was saying before I was discussing regarding the benzoic acid case. So the most interesting thing, if you are getting any MCQ having this inky urine, you can blindly go for colchicum. This is present only in this remedy in Allen's keynote. Make it clear, I am talking only regarding the Allen's keynote. And here all these things are associated with putrid decomposed blood. Yes, if it is brown and bloody, we can think about the decomposed state of blood. And here it is associated with albumin and sugar. Surely this is indicating that the kidney is suffering from some type of glomerulonephritis, where we can find microalbumin or albumin. It depends, and we can see the sugar in urine. So this is all regarding the characteristics of urine. So here even Dr. Hughes had mentioned that colchicum helps in the elimination of uric acid, leading to the recovery of gout complaints. So whenever uncle is suffering from any gout like symptoms, you can think about colchicum, and side by side you can think about benzoic acid and other uric acid diathesis remedies like thalassophilus. Then you can think about bryonia. That will be going good. And the most important character I want to discuss regarding the colchicum at last is metastasis. So metastasis is nothing but moving from one part to another. So here all the gouty and rheumatic complaints gets metastasis to the heart, which will lead to the valvular heart diseases or pericarditis. While we are discussing regarding the dropsy itself, we had seen regarding the pericarditis. So because of these conditions, we will be getting the common symptoms such as dyspnea and chest tightness. This complete picture had reminded me one of the disease condition, that is none other than rheumatic heart disease, which is caused by beta hemolytic streptococci, where it primarily affects the joints and moves towards the heart. So this is the similar pattern of suffering we can see in case of colchicum also. So still now we had discussed regarding the basic understanding of colchicum. So now we are moving towards the mnemonic part of colchicum, which will be very much useful for remembering the drug in exam point of view. So first let us start with C. So here C is indicating cold damp weather aggravation. Or you can remember easily that our uncle is a chilly patient. Colchicum uncle is a chilly patient. Then O is simply oversensitive. Yes, we know that our uncle is very sensitive and irritable to even the slightest external impression like noise, odor and everything. So you can remember as oversensitive old people. Then here L is indicating the movement of pain from left to right. This is exactly mentioned in Allen's keynote. And here this symptom is compared with another remedy called lachesis. And here the next C is indicating aggravation from checked sweat. And then comes H. Don't go directly with the alphabet. Then comes H. So here heat amelioration, which is exactly none other than warmth amelioration. Remember, try to remember this warmth amelioration. Then here I is indicating intestine scrapings in dysentery, where you can compare this remedy with cantharis and carbolic acid. And here the next C is indicating change of weather. And here U is indicating the unbearable pain, which can be compared with chamomilla. So here M is indicating mainly the metastasis, where the gout and rheumatic symptoms get metastasis to heart. So this is all regarding the colchicum. So C is for aggravation during the cold, damp weather, chilly patient. R O is for oversensitive old people. Then L for left to right pain comparing to lachesis. Then C for aggravation, checked sweat. And H for amelioration, warmth. And I for intestine scrapings and dysentery, comparing it with cantharis and carbolic acid. Then C is indicating the change of weather aggravation, and U indicating the unbearable pain, which can be compared with chamomilla, and M is indicating the metastasis, where the gout and rheumatic symptoms get moved towards the heart. So now let's see regarding the autumnale. So just join these two things. Aggravation during autumn, and we were having autumnal dysentery, and already we had discussed that in India autumn is mainly seen from September to October. Autumn is nothing but the season where we can see falling of leaves. So simply autumn can be called as fall. And T comes tympanitic abdomen, which we had seen through the farmer's cow. So tympanitic abdomen is one of the important symptoms. Here we can think about other gastric remedies such as China, then Lycopodium, then Asafoetida. These things can be easily compared. And here we have to discuss regarding one of the most important modality of colchicum, that is aggravation from touch and motion. And then here regarding the urine, already we had discussed regarding the urine, which is very scanty, suppressed, or sometimes it is brown, black, bloody and inky. I think inky you won't forget. And here in case of urine, there will be decomposition and we can find albumin and sugar. And this M is indicating the most important modality which I had mentioned just before, that is motion aggravation. He can't move. And in case of N, it is night aggravation and night watching aggravation, because he cannot do any hard work by sitting at night and reading, because uncle doesn't want that. Just remember this pattern of uncle, then it would be easy for you to write an examination, but don't write the uncle directly. Just for remembrance purpose, use our uncle. So in case of A, just try to remember that if Apis and arsenicum fails in dropsy, we can think about colchicum. That may help in curing the patient. And then in case of L, try to remember it belong to Liliaceae family. And at last, regarding the edema or generalized dropsy, which we had discussed before. So in case of atom, you have to think about dull camera also, which is having similar type of aggravation during atom season. So AU for atom, which is from September to October, which is none other than fall, and T for tympanic abdomen and aggravation from touch, and U for the specific urine symptoms which we had discussed earlier, and M for aggravation from motion, and N for aggravation night and night watching, and A for Apis and arsenicum fails in dropsy, we can think about colchicum. Then L for Liliaceae and E for edema or dropsy. So this is all regarding the mnemonic part of colchicum. So now I would like to make you people meet my uncle. Try to understand that our uncle is sitting down, as we cannot draw completely our uncle in standing position in this slide. That would be difficult. So here comes our old man, our uncle, whom we were discussing still now. So here you can see he had masked up just to avoid the smell of food, whatever it may be, he cannot tolerate. Here you can see his full abdomen, which is completely filled with air. So it is none other than the tympanic abdomen, which we were discussing. And here you can see the falling of leaf, which is indicating the atom aggravation and autumnal dysentery. So here comes our dysentery. So our dysentery is having the scrapings of intestine, which was compared with cantharis and carbolic acid. Our uncle is sitting just because he don't want to move, because motion will always aggravate him, whatever it is, like nausea or whatever the rheumatic complaints it may be. And you can see here he is saying stop or no to all these things, that is light, then noise also he cannot tolerate. He cannot tolerate the odor of cooking food, and he cannot bear anyone touching his great toe, which will lead to severe unbearable pain. So this is all regarding the pictorial representation of our very strict uncle. I think this pattern might be very helpful for you to understand the remedy in a better way. And if you want us to discuss any other remedy in the similar pattern, just comment below which remedy it can be, and we will continue the discussion with that. Happy learning with us. Thank you so much.